हाँ जी, of course कर दो, स्टार्ट करते हैं। Hello everyone, welcome to Pediatrics by Dr. Anand, and I hope my voice is audible to everyone. Good evening, all the amazing people. Hello everyone. Yes, I hope my voice is coming now. Perfect. Chalo. Good evening, everyone. Welcome to Pediatrics by Dr. Anand. I hope you guys are doing amazing. I hope my $1,000,000 face is coming to all the amazing people. Today's topic of choice we're gonna talk about is FMG recall questions. How's everyone doing? I hope you guys are doing amazing. Yes. Hello, good evening, Dr. Personnel, Dr. Shubham, Shehbaz. It takes around like some 3 to 5 minutes for the whole video to buffer. That's why sorry for coming a little late. वो टाइम लगता है थोड़ा सा एक्चुअली इसलिए सो येस लेट्स स्टार्ट दिस ब्यूटीफुल क्लास माय नेम इज डॉक्टर आनंद आई होप यू गाइस आर डूइंग अमेजिंग and this is the beautiful session where we're going to talk about what you called FMG recall questions. Okay, so my name is Dr. Anand. To all the amazing students who wants to know about me, welcome to the happy the beautiful thing of cerebellum. My name is Dr. Anand. I've done my MBBS from Rajiv Gandhi University Health Sciences, Bangalore, Karnataka. There are a lot of students who wants to know my college name, where I did my MBBS and where I did my MD. I would love to tell you, bro. I did my MBBS from Ambedkar Medical College, AMC, Dr. B.R. Ambedkar Medical College, Dr. Bhim Rao Ambedkar Medical College. I did my MBBS. I did my MD from Tirthankar Mahavir University, TMMU. I did my Tirthankar Mahavir University. It is in Moradabad. It's in UP. I did my MD from there. There were many students who were craving and crazily waiting where I've done my MD. Thank you so much for all your love and support. You guys are so amazing. Thank you so much for showing such a beautiful and crazy love regarding pediatrics by Dr. Anand. I hope now you have got where I've done my MBBS and MD. I've done my SR sheet from Lady Harding and also from NDMC Medical College, North Delhi Municipal Corporation. The college name is Hindu Rao Hospital. Let's start this beautiful class. Today we're going to talk about the FMG recall questions. Happy question. We'll try to understand the topic in a very beautiful and amazing way. Before starting any amazing segment, we always have a beautiful quote, and today's $1,000,000 quote will be what? The quote is this: scar tissue is stronger than regular tissue. Realize your strength and move on. Scar tissue is stronger than the regular tissue. Realize your strength and move on. So very important. Please remember, don't say that, God, why have you given me problems? Why me? Don't say that. Say try me. That's how you should do. It is scientifically proven, the scar tissue, if you get problems in life, the more immune you become, the more strong you become, the more scar you have in your body, the more strong you are. Scar tissue is more stronger than the healthy tissue. So once you get a cut and then you have a healing and a scar, that is the strongest tissue, and that should be your soul and manpower. Scar tissue is stronger than the regular tissue. Realize the strength and move on. Today's topic of choice we're going to talk about is happy questions on the FMG 2023. Luckily, the questions were really comfortable and nice for all the good and amazing FMG students. Let's start this class. A newborn baby was born through cesarean section, did not cry immediately after birth. On further evaluation, he had heart rate less than 60 beats per minute. What is the next best step? So we have so many amazing students who are there. That's great. Very good, bro. So what do you think? If a baby has a heart rate less than 60 beats per minute, what do you want to do? I hope you all agree. Heart rate less than 60 beats per minute. In the NRP, in the neonatal resuscitation protocol, we have done very beautiful heart rate less than 100 and heart rate less than 60. If a baby has a heart rate less than 60 beats per minute, of course you start a chest compression and bag and mask ventilation in 3:1. In 3:1. 1 2 3 1 1 2 3 1, like that. Okay, dude? So 3:1 is the ratio we do for chest compression and bag and mask ventilation if the heart rate is less than 60. Can you answer in the comment, please? Dr. Shubham, Osama, Shubhangi, all my dedicated happy followers, thank you so much for all the love and support. If the heart rate is less than 100, bro, then what will you do? If the heart rate is less than 100 beats per minute, then definitely you do only and only back and mask ventilation. Every single topic has been done with a lot of immense dedication and love. I hope you guys are following the lectures and all the channels. They are really beautifully, I have done it. Okay, so I'll repeat again. In this slide, one thing I have understood: if a newborn baby has heart rate less than 60, I must do chest compressions and bag and mask ventilation in the ratio of 3:1. If the heart rate is less than 100 beats per minute, I only bag and mask ventilation will be done. I hope this much is clear to all the happy students. Hello, Dr. Shubham. Hello, Shubhangi. Hello, Sama. We have Kshitij. Yes, that's great. We have Girish. Perfect. All the great students. Lot of love. Very nice of you. Next question. One student, these are the recall question, guys. It is not a copy paste question. It is like a recall question which students told that this might be the question which had come. There was one student who was telling the sir, he said the sir, the question was portrayed in this manner actually. What is the indication of starting chest compression and bag and mass ventilation in neonatal resuscitation? One student had told me that sir, this was this way the question was there. So even though if the question was like this, okay, when do you start chest compression and bag and mass, we beautifully can answer heart rate less than 60 beats per minute. We do the chest compression and bag and mass ventilation. Great. Very good. Perfect. Next question, please. In the beautiful next question we have is this one. Yes, now this is the good question. How much percentage of oxygen should be given for a newborn baby initially in the neonatal resuscitation if the baby is having apnea or heart rate less than 100 beats per minute? This is a good question. This was another question came from neonatal resuscitation protocol, which we have elaboratively discussed in our amazing classes. So how much percentage of oxygen should be given for a newborn initially बिल्कुल begin में शुरू में if the heart rate is less than 100 beats per minute? तो हम सब जानते हैं अगर heart rate less than 100 होता है तो हम bag and mass चालू करते हैं. We do the bag and mass ventilation. Bag and mass ventilation, that's very important. Bag and mass ventilation में एक होता है reservoir and very important एक होता है oxygen, right? The part of the bag and mass ventilation, if you all know, this basically is our beautiful bag and mass ventilation, which is also known as AMBU bag, which is also known as positive pressure ventilation. PPV भी कहते हैं इसको, AMBU bag भी कहते हैं और BMV भी कहते हैं. BMV is bag and mass ventilation, PPV is positive pressure ventilation. All everyone beautifully know in the bag and mass we have the pop-up valve. This is the happy mask. This is the, it is a self-inflating bag. Now this is important, bro. एक तो होता है reservoir, one is the reservoir and one is the oxygen tube basically. So this is important, dude. When you start initially when the heart rate is less than 100 and if I'm planning to start a bag and mass, I start with something very basic or minimum. That is nothing but I start with something known as 21% oxygen. I start very important. Initially, if the baby is still not responding after my bag and mask, then definitely if the child has a labored breathing or something, then definitely I can connect my oxygen tube and my, the percentage of oxygen automatically will increase. But one take home message I must understand, if the heart rate was less than 100, I opened bag and mask ventilation को मैंने हाथ लगाया, and usually bag and mask ventilation में जो basic initially the percentage of oxygen required, bro, is nothing but 21%. So 3 questions I must know. If I have a AMBU bag without the reservoir and without the oxygen, can you answer in the comment कितने % oxygen हमको पहुंचता है? How much % of oxygen actually will reach me if I have a AMBU bag without the reservoir and without the oxygen inlet? You know, just now I showed you, dear, this is the oxygen reservoir and this is the oxygen inlet. So without the reservoir, without the oxygen tubing or oxygen inlet, 21% of oxygen will reach. 21% oxygen will reach, and this was the exam question. Here only let's cover other questions also. If I have a AMBU bag and I have connected the reservoir, very importantly, and I have connected the oxygen inlet also, can you beautifully answer in the comment? Osama, what do you think? Yes, very good. So that's very beautifully told by Piyush Bhardwaj, Sagala. We have Vishnu, Ajay, Nitika Thakur Pandey. Yes, beautiful, amazing. So if I have connected a reservoir, if I have connected a oxygen inlet also, then obviously, dear, 100%, very good, that's very well put, 100% oxygen will reach to me. Are you understanding? Without the reservoir, without the oxygen inlet, 21% oxygen. With the reservoir, with the oxygen chamber, then it will be 100% oxygen, it will reach me. And last but not the least, I have the reservoir, but I have not connected the oxygen pipe. Yes, Dr. Shubham, my dear Dr. Shubham, Sarthak bhi aaya. Okay, good evening, Sarthak. How are you, Sarthak? All good, Sarthak? Sarthak is one of our dedicated followers and very good All India rank topper. He's a very good student. So if I have a reservoir but I don't have an oxygen inlet, so we all know that around 40% oxygen will reach me. So 3 things I have understood: 21% oxygen, 100% oxygen, and 40% oxygen. If I have the reservoir and the oxygen inlet, obviously then the oxygen it will reach me will be 100%. If I don't have the oxygen and don't have the reservoir, then of course the room temperature, the room air, 21% oxygen will reach the baby. And if I have connected the reservoir but not the oxygen inlet, then 40% 100% oxygen will reach the baby. Very good, very good, Sarthak Praharaj, very good. So we have beautiful students who are participating. A very quick, motivating quote which says, दिल का साफ होना ज़रूरी है, दिल का साफ होना ज़रूरी है, क्योंकि कोई वादे करके भी साथ नहीं देता है, तो कोई बिना वादे के भी ज़िंदगी भर साथ निभाता है. जैसे कि हमारे प्यारे प्यारे स्टूडेंट्स, we have so many students who are a dedicated follower or and dedicated hardcore fan of our happy classes, and thank you so much for all the love and support. Okay, now one more question, very important. Let me minimize this beautiful image. Let's see if you can answer. So this is the good question. Luckily, all the questions this time were really very comfortable and very classy question they had asked. A 2 days old neonate came with complaints of number one, the baby had distress. Number two, the baby had frothing of secretions. The baby had dribbling of saliva. These 3 points were there. And mother having history of polyhydramnios. According to the X-ray shown below, what is your best possible diagnosis? So very beautiful. Before me even telling you the options, if I kind of maximize the image for you. So this was the image, like recall question image, not this. I have not made the paper, but this was the connected image which I can appreciate. So what is this? Coiling of the nasogastric tube. Can you beautifully answer in the comment? Yes, Piyush Bhardwaj. Yes, Dr. Nitika Thakur, Surbhi and Priya Gupta. That's right. Coiling of the nasogastric tube or coiling of the rubber catheter. Sometimes OPGI 9th edition says that sometimes if the nasogastric tube will not available, then you can put a rubber catheter also. So that's what. So coiling of the nasogastric tube, number one, and the baby has distress, frothing of secretion, dribbling of saliva, and mother having history of polyhydramnios. What abnormality we should think of? There's only one abnormality, bro. The answer is tracheoesophageal fistula. Tracheoesophageal fistula. Now again, the class will not stop here. I will ask you 1 million more questions, okay? Because you are a beautiful and the best soul on this planet. Okay, so tell me, what is the name of the classification, dude? What is the name of the classification of TEF? Dr. Sarthak Praharaj, बिना मार खाए कौन बताएगा? We have Shubham also. Shubham bro, बता मुझे आंसर इसका. What is the name of the classification for TEF? Any idea, any guesses? Yes, Dr. Galva, Dr. Chinna, very good. Yes, that's right. So we have something known as gross classification. Gross classification is the name of the classification for TEF. And I hope you know that. Yes, Dr. Priya Gupta, one of our another beautiful follower. How many types of TEF we have? We have type A, B, C, D, E. We have 5 types of tracheoesophageal fistula. And the name of the classification is gross classification, which is the most commonest type of TEF. That is another exam question. The mnemonic we have is CAD, cat. The most commonest type of TEF is nothing but type C, followed by type A, and the least common will be type D. Okay, type C followed by type A and followed by type D. Yes, Dr. Shubham, मेरे प्यारे भाई शुभम, that's true. आज जिम गया था, आज मेरा थाइस था. तेरे को फोटो भेजता हूँ मैं इंस्टाग्राम पे, ठीक है? Yeah, very good, perfect. So that's what. And I hope you know that, guys, why polyhydramnios is connected to TEF. Very beautiful question. Please समझ के पढ़ें, have a beautiful connection in your brain, have a spiritual contact, and everything will make sense. Okay, just work hard and just be with me. Imagine, bro, you're reading this question for the first and last time. पहली और आखिरी बार ये टॉपिक पढ़ रहे हो तो पता होना चाहिए why if the mother has a polyhydramnios, why it is connected to tracheoesophageal fistula. Because we all know that polyhydramnios nothing but too much of liquor. Polyhydramnios means too much of liquor, right? Obviously oligohydramnios is decreased liquor and polyhydramnios is increased liquor. So ये liquor बनता कैसे है? How does the liquor form? So we all know that baby's urine is nothing but the liquor. That's how it is formed. Baby in the 9 months of pregnancy, baby passes urine, swallow urine. That is nothing but the liquor. And as I say that the mother is a case of polyhydramnios, nothing but too much of liquor. Too much of liquor means indirectly too much of urine. Too much of urine means baby passing urine very well, but he is not able to swallow the urine. Baby passing urine very well, but he is not able to swallow the urine. Why he is not able to swallow the urine, bro? Because he is having some defect over here. And the most commonest defect in the esophageal disorders is nothing but tracheoesophageal fistula. Did you understand, or should I use Spanish or Italian language for this? So I hope you know that. The beautiful answer is TEF. The other answers were HMD, respiratory distress syndrome, transient tachypnea of newborn, and tracheoesophageal fistula. So according to the best possible diagnosis, I think definitely tracheoesophageal fistula is there. Another very good. Is everyone understanding? Yes or yes, yes. Please like, or you can give a golden heart or a pink heart or a magenta heart if you are able to understand. Life is beautiful, bro. You will be only respected if you have good knowledge. Otherwise, not even a doggy will ask you if you don't have a good knowledge. You must have a beautiful knowledge, then only your eyes will shine. You will have a spark in your eyes and you can achieve anything. Is everyone understanding? Yes or yes, yes. Please let me know. Sarthak is very sweet. Sarthak is saying similar analogy in renal agenesis associated with oligohydramnios. Ooh, that's right. You're right. Very good. Pragati says yes, yes. Very good. Perfect. Again, as we are doing the amazing questions, it is our responsibility to look for the other options also. Can you beautifully answer in the comment section why this question ka answer is not HMD or RDS? Why this question ka answer is not hyaline membrane disease or respiratory distress syndrome? Number one, very, very important, as we all beautifully know, the other name of HMD is nothing but RDS. HMD and RDS are same thing. Hyaline membrane disease or respiratory distress syndrome is like same thing only. It is another name of HMD is RDS. Why this question is not HMD or RDS? Because if I was the examiner and if I want to make an answer on RDS or HMD, I would have written that it is a preterm baby is there. Like the baby should be a preterm baby. I would have written the baby will have a whiteout lung, whiteout lung. As the baby is preterm, then I understand there will be a surfactant deficiency. And yes, the baby will have a distress or the baby will have other problems. So that's what, if this was the question of RDS or HMD, it would be a preterm baby having distress, having retractions. X-ray would have shown whiteout lung, and then the story would have gone to HMD or RDS. Yes, very good, very good, very good. Perfect, perfect. That's beautifully said. Can we have the next question, please, on this planet? Yeah, which is the most common congenital anomaly of the esophagus? Can you beautifully answer in the comment, please? Jyoti Sahu, Nitika, Anita, Priya, Mohammed Anas, Ifra, Malik, Priya Gupta, and Mera Pyara Bhai Shubham. What is the most common congenital anomaly of the esophagus, bro? What do you think, dude? The answer is nothing but esophageal atresia. Yes, esophageal atresia. And out of these esophageal atresias, the most commonest is nothing but tracheoesophageal fistula. We will do, we will cover the associated questions also, bro. Okay. Not just this question, will cover everything. Yes, exactly. Ashish says, dude is too good to hear, boss. Yes, brother, life is just one. We all are one family. Very good. Perfect. This part we have done. The name of the classification I have told you is the gross classification. Yes, now this is very beautiful. I have to ask you other questions also. One more question I'll ask you on TEF, bro. Can you please tell me in the comment section that which one will have a gas in the abdomen? Because dear, this was the recent NEET PG question also. Which type of tracheoesophageal fistula will have a you'll see a gas in the abdomen? Can you beautifully answer in the comment, please? Exactly. Dr. Shubham, one of my very good friend, he says आपकी क्लासेस के तो मजे ही अलग हैं. अच्छा, मैंने गाना तो सुनाया नहीं अभी कोई. अभी गाना सुनाएंगे, अभी सुनाएंगे, प्यारा सा गाना सुनाएंगे, ठीक है? Yes, exactly. Dr. MD says, sir, is this useful for NEET PG? Oh, yes, bro. It is very, very useful for NEET PG. NEET PG, FMG, all these syllabus are one dear, and these are like FMG and NEET PG question paper is almost run parallel. If the NEET PG, they have asked that what is the name of the classification, TEF is gross classification. Then FMG also one parallel question they had asked. Now this question let's cover this point. I ask you this beautiful question: which type of TEF will have a gas in the abdomen? Priya Gupta has a beautiful answer. जब ध्यान से देखो, see dear, number one, the name of the classification is gross classification. We have type A, type B, type C, type D, and type E, tracheoesophageal fistula. Wherever you have a connection, dear, wherever you have a connection with my trachea and my food pipe or the tummy, there of course you will have a gas in the abdomen. Here also we have a connection, I will have a gas in the abdomen, and here also we have a connection, I will have a gas in the abdomen. Can we therefore appreciate, yes Shubham, you're right brother, type C, types D, and type E, TEF will have a gas in the abdomen. And can we beautifully appreciate this part, dear? Type A and type B will not have any gas in the abdomen because there is no connection, bro, of the trachea with my food pipe. Windpipe से ही हवा मेरे पेट में आएगी ना, and I will have a gas in the abdomen. So type A, can we therefore appreciate this point? This is a very important medicine question also. Can we appreciate this point that type A and type B, T, E, F will not have a gas in the abdomen, and type C, D, E definitely will have a gas in the abdomen, that you should know. Okay, coming to the next question. A quick motivating quote which beautifully says, जो बदल जाए वो यार कैसा, जो बदल जाए वो यार कैसा, जो छोड़ जाए वो साथ कैसा, सब कहते हैं प्यार फिर से हो जाता है, जो फिर से हो जाए वो प्यार कैसा. So let me know if you agree with me. Okay, a 4-year-old boy with periorbital swelling, facial puffiness, and pedal edema who was on steroid therapy. Very beautiful. See, these questions are so direct, bro. Like only this first line, if you can read, can you tell me what are we talking about? 4 साल का बच्चा है, a 4-year-old boy with periorbital swelling, facial puffiness, pedal edema. All three things are there. Then I think, of course, I can write anasarca, generalized full body swelling, and I was on steroid therapy. A 4-year-old boy who had a anasarca and who was on steroid therapy. So आंख बंद करके somewhere I'm talking about nephrotic syndrome. Somewhere or the here, of course, I'm talking about dear nephrotic syndrome. Right? That's right. Perfect. On further evaluation in the electron microscopy, patient had effacement of the photo processes of the podocytes. So this is like a classical finding you see in a case of MCD or a minimal change disease, which is nothing but indirectly we are talking about the nephrotic syndrome. Patient also has proteinuria which was more than 40 milligram per meter square per hour. So very important, you know that, right? Less than 4 to 40, and more than 40. Less than 4 milligram per meter square per hour is the normal proteinuria. Normal, in my normal urine, I can find proteins. The normal proteinuria is less than 40 milligram per meter square per hour. Then we have 4 to 40 and more than 40. 4 to 40 is nothing but non-nephrotic range proteinuria. Non-nephrotic range proteinuria, whereas more than 40 milligram per meter square per hour is nothing but nephrotic range proteinuria or a massive proteinuria. And again, see, what is your possible diagnosis? So कोई अंधा भी इसका आंसर दे देगा. So very important, bro. If you have the overview also of the topic, very beautiful you can answer. So this is so beautiful question, and the answer is nothing but nephrotic syndrome. Every single point is touching towards the nephrotic syndrome. Do you? Yes, Sarthak Praharaj. Yes, that's right. Effacement of the food processes only denotes minimal change disease. That's very well put, brother. Very good, Sarthak. Very good. Okay, perfect. So that's it. Acha, can you answer in the comment section, please, why it is not nephritic? Why it is not nephritic? मुझे तो nephritic लग रहा है. एक बच्चे ने मैसेज किया था, सर मेरे को तो nephritic लग रहा है. If I was the examiner of the nephritic syndrome was an answer, I would have written hypertension, I would have written hematuria, I would have written I have RBC cast in my urine, RBC cast in the urine. So these all things I would have written, dear, if I was having nephritic syndrome. Okay, and nephritic syndrome, you don't see a massive proteinuria. So that's what the beauty of the question is, that if you have a little bit pointer knowledge also about the overall topic, you can very well write. So as we all know, why it is not nephritic syndrome. So nephritic syndrome will have a history of upper respiratory or a lower respiratory tract infection followed by hypertension, then hematuria, and then I have a RBC cast in my urine. And the most common cause of nephritic syndrome in a baby will be PSGN. PSGN is nothing but post streptococcal glomerulonephritis. Is everyone beautifully understanding? Yes or yes? बहुत ही मोती की तरह क्वेश्चंस बनाए गए हैं, बहुत सिंपल और अच्छे क्वेश्चंस बनाए हैं, ताकि हम these question which has been made by the examiner, God bless him, because he has literally tried his best, that if the student has little bit overview knowledge also of the whole topic, कि nephrotic में you don't see hypertension, nephrotic में you don't see hematuria, nephrotic में there is massive proteinuria, and opposite is there in the nephritic you have hypertension, nephritic you have hematuria. Has everyone understood this much, or should I use some Italian or Spanish language? Okay, perfect. Yeah, Nikhil कुछ कह रहा है, निखिल कह रहा है, questions looks easy but on exam day even easy question looks scary. Why this happens, sir? Any solution to it? So the only important solution, dear, is nothing but revise so many times that we get a little more stronger grasp regarding the topic and the subject, and do the last 3 year important MCQs also, and not just the MCQs, dear. For all the student, it was Obviously, MCQ is important, but that topic which they had asked in the MCQ should be thoroughly covered. It has been seen in the NEET and FMG, of course, last 3 years, the topics has always been the same. Severe acute malnutrition, there's always been a question. Last time was a photo, this time is something else. Neonatal resuscitation protocol, literally topics are like same. बस क्वेश्चन थोड़ा टेढ़ा मेढ़ा उधर हो जाता है, नेचुरल सी बात है, वो तो होना ही है करके, ठीक है. Yes, okay, beautiful. Let's go to the next question, guys. 7-year-old female child with cough coryza conjunctivitis with a centripetal rash. The diagnosis is dash. So again, in the infectious disease chapter in our classes, we have very beautifully covered here. Measles ka patient agar aata hai, if you get a measles patient in a busy OPD, how do you detect measles in 5 seconds, or what are the 3 leading questions you ask? C, C, C. C, C, C is the answer. Cough, कोराइजा एंड कंजंक्टिवाइटिस. खांसी है, हाँ जी डॉक्टर साहब है. रनिंग नोज, कोराइजा है, हाँ जी डॉक्टर साहब, ही इज हैविंग रनिंग नोज. कंजंक्टिवाइटिस, इज योर चाइल्ड हैविंग रेडनेस अराउंड द आईज? या डॉक्टर, हिज आईज आर लिटिल रेड. कैन यू आंसर इन द कमेंट प्लीज? हाँ, मीजल्स, वेरी गुड. ऑस्कर को भी पता है. माय डॉगी आल्सो नोज द आंसर इज मीजल्स. वेरी गुड, आई एम सो प्राउड ऑफ यू. बट नाउ टेल मी द आंसर. इन मीजल्स व्हाट कंजंक्टिवाइटिस डू यू सी? डू यू सी अ प्यूरुलेंट कंजंक्टिवाइटिस और यू सी अ नॉन प्यूरुलेंट कंजंक्टिवाइटिस? मरने से पहले कौन ये आंसर देना चाहेगा? वेरी गुड, वी हैव सो मेनी स्टूडेंट्स ऑनलाइन. वेरी गुड ब्रो, वेरी गुड. प्रिया गुप्ता, perfect. Anita, Aina, Sangeeta, Mohammed Anas, Sangeeta again, Soumya, Arpan Datta, Dr. Hashi. Yeah, okay, cool. Yes. So, what kind of conjunctivitis do you see in a case of measles? So very, yeah, Dr. Priya Gupta. I'm gonna write the student name who will be the first one to answer. Dr. Priya Gupta has a very beautiful answer, dear. Very good. You see a purulent conjunctivitis. Doctor, the redness he's having around the eyes, no, there's some sticky discharge coming from that redness. So you see a purulent conjunctivitis. Remember. And Kawasaki disease also very important, will have a conjunctivitis, but Kawasaki will have a non-purulent conjunctivitis, whereas measles will have a purulent conjunctivitis. Purulent means pus forming, nothing but sticky discharge around the eyes. Have you understood? I hope you have beautifully got this point. Acha, centripetal rash. What is the meaning of centripetal? I have never heard this name. Can you beautifully answer in the comment? Yes, Dr. Shubham, मेरे प्यारे शुभम, बिल्कुल सही बता रहा है तू ब्रो, बिल्कुल ठीक बता रहा है. Okay, what is the meaning of centripetal? See, we all know that something known as centrifugal rash and centripetal rash. Centripetal, petal मतलब जो पेट की तरफ ज्यादा हो. In the case of centripetal rash, the rash is everywhere, but the distribution of rash is more toward the center. Centripetal, in Hindi we say पेट वाला area, in English we say that it's more toward the center, basically in the trunk or the abdomen side. That is known as centripetal rash. Measles, chicken pox, all these are centripetal rash. Okay, yeah, perfect. Middle of the body, yes. Mrityunjay, nice name. Mrityunjay is right. Aina is right. Centrifugal, dear, can you example? I forgot, yaar. Can you please tell me 3 examples on the centrifugal rash? F for fugal, F for far areas, right? The rash is everywhere, but the distribution of rash is more towards the far area. Far matlab means hand and foot and all that. What are the beautiful examples? That's very well put. The examples of centrifugal rash. Number 1, can I write HFMD? Hand, foot and mouth disease. शब्द से ही पता लगता है. By the name only you can get it, bro. Hand, foot and foot नीचे था. Foot, mouth and hand. So centrifugal rash. Okay, bro. परफेक्ट. एंड इवन स्मॉल पॉक्स, किसने बताया प्यारा सा आंसर? अच्छा, मृत्युंजय आया, कोई नया बंदा आया हमारे फैमिली में. तो स्मॉल पॉक्स, यस, दैट्स वेरी वेल पुट. स्मॉल पॉक्स हैव अ सेंट्रीफ्यूगल रैश. एचएफएमडी हैज अ सेंट्रीफ्यूगल रैश. कैन आई राइट एक्रोडर्मेटाइटिस एंटेरोपैथिका? डू यू एग्री विद मी? वी हैव डन दिस 1 million टाइम्स. सार्थक कहाँ पे? सार्थक, यस. एंड एक्रोडर्मेटाइटिस एंटेरोपैथिका, इट इज बिकॉज ऑफ डेफिशिएंसी ऑफ, वी ऑल नो दैट, इट इज बिकॉज ऑफ डेफिशिएंसी ऑफ जिंक. द जीन म्यूटेशन इज, वी ऑल नो दैट, आई होप यू नो इट. SLC39A4, this is again FMG question last year आया था. SLC39A4 is the gene mutation in acrodermatitis enteropathica. It is because of deficiency of zinc. Acro means periphery, dermatitis means kind of rash. The patient will have perioral, perivaginal and hand, foot, mouth rash. So the examples of centrifugal rash will be hand, foot and mouth disease, smallpox, acrodermatitis enteropathica. Very good, perfect. So these are the beautiful example. Even this rickettsial infection also nothing but scrub typhus, where the drug of choice is doxycycline. So the patient will have, which is because it's caused by rickettsia sutsugami, we all know that. So that also will have a centrifugal rash. So this was the picture. Again, this was a recall picture. The rash of the measles, we all know that it starts behind the ears and face and trunk and the whole body. That's how beauty goes of regarding the what do you call the measles rash. Two questions, two questions I have to ask you. Which is the most common, which is the most common complication of measles? Which is the most common complication of measles? And then which is the most common cause of death in measles? Very, very important. Million times. हमारे पास in our hospital also we had a measles patient 2 days back. I had asked my DNB people. Yeah. सार्थक सेज सेंट्रीपिटल रैश का डीडी। देख कितने प्यार से आंसर कर रहा है सार्थक, वेरी गुड ब्रो। अभी बताता हूँ। हाँ तू सही कह रहा है डियर सार्थक, यू वेरी राइट ब्रदर, मेरे प्यारे भाई। एंड आई हैव मेड अ चार्ट आल्सो डियर, आई एम गोना शो यू, ओके? सो जस्ट वेट। वेरी गुड, वेरी गुड। एनीवन हैव एक्स्ट्रा पॉइंट्स, यू कैन प्लीज आंसर इन द कमेंट्स। सो ब्यूटिफुली दिस beautiful souls are answering so good. So the most common complication of measles is otitis media, and the most common cause of death in measles is pneumonia. These all are exam questions, dear. And the most common late complication, the most common late complication in a case of measles is nothing but SSPE, which is nothing but subacute sclerosing panencephalitis. Subacute sclerosing panencephalitis. That's it, dear. The most common complication of measles is otitis media. We had a patient 2 days back. I told my DNBs to get a ENT reference for otitis media. I told them to get a X-ray to rule out pneumonia. And then the late complication, after 10 years, the patient will come with SSPE. That's it. So that finishes measles. Let's go to the next question. Sarthak, see, bro. So, bro, as very beautiful picture, my dear. Can we appreciate this point? This is like a chicken pox, like a centripetal rash. Very beauty of this question. Can we appreciate that the black dots are more towards the center or the tummy area, whereas in a case of smallpox, bro, it is centrifugal? Can we appreciate the distribution of the black dots? The rashes are more towards the far areas. And we have a very quick mnemonic, our beautiful people, Dr. Sarthak and Shubham. Centripetal, we had a mnemonic. Red rashes scare patients very much. Red rashes scare patients very much. So rubella, roseola, scarlet fever, parvovirus B19, and varicella, and erythema infectiosum, and measles. These are the examples of nothing but centripetal rash. इतना प्यारा जवाब कौन दे रहा है? सार्थक, very good. Most common cause of death in measles is pneumonia. Yes, 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 yes. वेरी गुड सार्थक, वेरी गुड। आपको मिलता है बहुत सारा प्यार, बहुत सारा प्यार। वेरी गुड, दैट्स राइट। ओके, वी हैव स्वीटी 1994 which says good evening sir. Good evening, good evening, how are you? All good? You want cold coffee? Should I get you something? So very, very important, dear, please remember centrifugal rash examples was CARS cars, Coxsackie virus, Rocky Mountain spotted fever, and secondary syphilis, and other things I have told you, like smallpox, and like apna wo wala acrodermatitis enteropathica. Ooh, okay, that's right. Acha, Sarthak is telling hi-fi answers. He says high voltage spike potentials cause radamassacre complexes on EEG for SSP. Ooh, I can only say ooh, that's it. Okay, हाँ जी, क्या हुआ? खाना अब टाइम हो गया, मुझे 9:13 हुए, अभी 10 मिनट में 10। What is D in the pediatric emergency care? Very beautiful question. This came in DNB exam 4 months back. I remember it came again in this exam of our FMG, and this came in nursing exam also. Dude, finish all the last 3 year question papers, not just of FMG, of NEET PG, nursing exam, AIMS, INICT, जो मिल जाए खत्म करो, खत्म करके अपनी आत्मा में ऐसे घुसा लो कि हद नहीं। Very, very important. We all have done that. What is D in the pediatric emergency? D for disability, and I hope you know that. पहले हम करते थे ABC. In any pediatric emergency, we used to do ABC. Then we started TABC. Then we started TABCDE. That we started. Whenever a patient come, I will check the patient's temperature. I will maintain its airway, breathing, and circulation. Airway, breathing, and circulation. Then D, very, very important for disability. I will make sure the patient is catheterized or on the bed, of course. And exposure, I'm going to expose the patient and look for any problems, like how the story starts in an illness and all that. So this is the beautiful thing. That's right. Okay, acha, Atur Rahman keh raha hai, first question mein there is no option of CC and BMV. Thank you, thank you, बहुत sweet, very good, thank you, और कुछ क्वेश्चन क्या था ये बता दे भाई, वो इंपॉर्टेंट है। ठीक है, सिंग इन रशिया वी हैव एन आईडी नोन एज सिंग इन रशिया हु सेज किंग ऑफ पीडियाट्रिक्स। ओह स्कैरी, साउंड्स गुड। ठीक है, लेट्स गो टू द नेक्स्ट क्वेश्चन ब्रो। Very beautiful question, guys. Finish this whole, such a happy questions we have on this planet. Can we finish the whole book now? 11 months old female child. What is the dose of vitamin A? कितना प्यारा, simple सा happy question है. So we all know that less than 6 months baby, the dose of vitamin A is 50,000 IU, 50,000 international units. 6 months to 1 year, the dose is 1 lakh IU. More than 1 year baby, the dose is 2 lakh IU. That is the beautiful topic. Doses of vitamin A, उस हिसाब से सबसे सुंदर आंसर बनता है हमारे पास, दैट इज 1 लाख IU। या ओके, कौन बोला 50,000? बेटे मार खानी है, कौन है डॉक्टर बाइसेप्स? आओ इधर आओ, जिम के बाहर मिल मेरे को, अभी अभी मिल, आधे घंटे में तेरे को बताता हूँ मैं। हैं सो the baby is 11 month old, right? 11 month old. So less than 6 months baby, the dose is 50,000 IU. 6 months to 1 year baby, the dose is 1 lakh IU. More than 1 year old, the dose of the vitamin A will be 2 lakh IU. And an extra point, if the child is more than 1 year but less than 8 kg, if the child is more than 1 year then, and less than 8 kg, then we will not give 2 lakh IU, we will give 1 lakh IU. That you should know. Okay, yeah, that's very good. Acha, less than 6 months, more than 60 lakhs. So that's one. Okay, yeah, that's right. Perfect. Very good. This was our answer. Very beautiful one. Yes, a 1 month old doll-like faces with patient with a hepatomegaly diagnosed case of von Jurke disease. What is the most common enzyme deficient in children? Again, see such beauty of the question. Like the question is very simple, luckily the examiner has not tongue twisted the question. He has just declared right now the patient has the von Jurke. What is the common enzyme deficient? Like sometimes inborn errors and all, or these glycogen storage disorders are very crazy topics, but very easy. But still, if you have a little overview also, we can very beautifully answer in the comment. Yes, the beautiful answer is, someone says C, someone says D. So we all know that glucose 6 phosphatase is the enzyme deficient in a case of von Jurke. If you're a newcomer, you have no idea what is von Jurke, let me tell you. See, von Jurke disease क्या होता है? बहुत easy है. It is a glycogen storage disease. It is a glycogen storage disease. Only one beauty of the point I want you guys to remember: von Jurke disease, the enzyme deficient is glucose 6 phosphatase. Von Jurke disease, the enzyme deficient is glucose 6 phosphatase. ठीक है? Right now, please remember this: von Jurke disease, the enzyme deficient is glucose 6 phosphatase. The कहानी होती क्या है? कहानी actually, the most common glycogen storage disease in children is type 1, that is von Jurke disease. In adult, it is type 5, that is McArdle disease. What happens in a case of von Jurke? If I am a newcomer, I have no idea about von Jurke. Just remember one thing: in my body, glycogen is converted into glucose 6 phosphate, and glucose 6 phosphate is converted into glucose. In my body, in the glycogen, in the metabolism, the glycogen gets converted into glucose 6 phosphate. Glucose 6 phosphate get converted into glucose. The enzyme responsible for this conversion will be glucose 6 phosphatase. The enzyme responsible for this conversion from glucose 6 phosphate to glucose will be glucose 6 phosphatase. In a case of von Jurke disease, there is a deficiency of this enzyme glucose 6 phosphatase. So this glucose 6 phosphate will not be able to get converted into glucose, and the patient will land up into hypoglycemia. Hypoglycemia, very, very important. That's how the story starts. And this glycogen gets converted, because there is no conversion, then so much of glycogen or in glucose 6 phosphate gets deposited in my liver, and I will have hepatomegaly. So can we appreciate in this case von Jurke disease, basically the enzyme enzyme deficient? निखिल कह रहा है, ओके, निखिल कह रहा है I can watch this stream whole night. और जो मुझे खांसी आ रही है उसका क्या करेंगे? 2 दिन से मेरी तबीयत बहुत खराब है, एक्चुअली खांसी हो रखी, मौसम ही एक्चुअली आजकल ऐसा है इस करके. So this beautiful thing I have understood, that the enzyme responsible for this conversion was this glucose 6 phosphatase, and there's a deficiency of this enzyme, and that's what happens in a case of von Jurke. Conversion will not happen. I will have hypoglycemia. This will get deposited in my liver, and I will have hepatomegaly. So that's what the glycogen accumulates in my liver, in my kidney, and I will have hypoglycemia plus hepatomegaly. If you're a newcomer, at least for heaven's sake, von Jurke, this words I want you to beautifully incorporate in your Salka and Kaira. Okay. That's it, and that's how the patient will have a doll-like faces, recurrent hypoglycemia, and hepatomegaly because glucose 6 phosphate accumulates in the liver. समझ में आ रही कहानी या नहीं आ रही? बादाम खाओ, अगर नहीं समझ में आ रही तो ठीक है. That's it. So that was the answer. And even in 2018 also, dear, we had this question: 7-month-old baby, recurrent hypoglycemia attacks with hepatomegaly. Connecting questions, same. That's why I thought of showing you the old questions also. Hypoglycemia with with hepatomegaly and this kind of doll-like faces. The beauty of the answer was von Jerke disease. So, हमारी कहानी, yes or no? Great, perfect. Has everyone understood this much? 5 more minutes and we're gonna finish this class. My mom is calling me for dinner. That's why I have to go. Has everyone understanding this much? Yes or yes? Yes. Please let me know. Dr. Apoor Mehra, one of my mentor, is there online. Good evening, sir. How are you, sir? Lots of love, sir. I love you, sir. Thank you, sir, for giving this beautiful platform of Cerebellum, where everyone is so happy and beautiful. A 5-year-old boy has consumed multiple iron tablets, and parents are worried for the treatment of the baby. What is the next best approach? Beautiful question, bro. Can you please answer in the comment, please? What is the answer, dude? So, एक baby ने बहुत सारी iron tablets खा ली हैं. Baby has taken too much of iron tablets. So we all know that even too much, if I'm taking too much of iron tablets, nothing but I'm kind of having a iron overload. So the iron overload, I want a chelator. I want a chelator. Chelator is someone who will take the iron too much from my body and excrete it. And we have beautiful deferasirox and deferoxamine. So these are the chelators, even in a case of transfusion dependent anemias, whereas thalassemias, which are nothing but transfusion dependent anemias, when you give too much of transfusion, no bro, there is always the iron overload. In a case of, that's why in a case of thalassemia also I give a chelator, nothing but deferasirox or deferoxamine. And here again indirectly FMG question, एक baby ने we have taken lot of iron tablets, and what will you do? You will give a chelator. That sounds a good answer. So please remember, the beauty of the answer will be deferasirox or desferoxamine. A few days back, I remember, like 5 days back only, I had put this question in our groups. Deferasirox dispersible tablet. One of my patient in the ward, we were recommending him, and I took a question that, guys, what do you think, where do you use this tablet? So that's what it is, a chelator, bro. The patient was a case of transfusion dependent anemias. When I, in a case of thalassemias, when I give too much of transfusions, iron overload हो जाता है, and that's why ये deferasirox iron को हमारी body से बाहर करता है. ठीक है, that understood. One more question I have, very beautiful. Yes, exactly. D-penicillamine, ये कहाँ use होता है? Can you beautifully answer in the comment, please? Where do you use D-penicillamine? Please, hello. You have 5 seconds to answer. 3 more minutes, and then I'm gonna finish the class. Dinner is ready. My mom is calling. That's why. Okay. Yes. बिन तेरे बिन तेरे बिन तेरे कोई खलिश है हवाओं में बिन तेरे. So yes, in a case of Wilson disease, bro, in a case of Wilson disease, copper everywhere. In a case of Wilson disease, very important, we use D-penicillamine and zinc. In these two things beautifully are, connected in a case of Wilson. In a case of Wilson. And acetylcysteine, NAC कहाँ use होता है? Can you answer in the comment? We have to cover all the MCQs and the other options, bro. In a case of any idea, which poisoning? प्रिया सेज नाइस वॉइस. थैंक यू एक और सुनाएंगे, एंड में गाना सुनाएंगे, एक और सुनाऊंगा अच्छा सा पुराने वाला. विच पॉइजनिंग ब्रो, मेरा गला भी खराब है एक्चुअली. विच पॉइजनिंग डू यू यूज नैक? कैन यू ब्यूटिफुली आंसर इन द कमेंट प्लीज? यस. आ गया, हो गया, मैं आ गया. In which poisoning do you use NAC? Can you answer in the comment? Yes. PCM, paracetamol poisoning. In a case of paracetamol poisoning, the antidote is N-acetylcysteine. Zinc and D-penicillamine are used in Wilson, and the chelator is nothing but this one used for thalassemia and iron overloads. That finishes this beautiful topic of all the amazing questions of the FMG 2023. And thank you so much for the participation. Has everyone understood? या जो भी पढ़ाया वो दिमाग के ऊपर से गया. If it has gone above the head, I recommend you guys should take 5 almonds. It's good for health. I take 10 because I go to gym. 1 spoon of honey will be good for your health, and even little cashew nuts will be nice actually if you are not able to understand. Okay, चलो ख्याल रखो. Okay, life is beautiful, bro. Before leaving, we always have a beautiful quote, my dear, which says, pain is temporary, but quitting will last forever. pain of doing so much for exams, pain of studying or getting, anxious or stressed out. This is temporary. Everything will make sense by the end of the journey. Everything will make sense by the end of the journey. Enjoy the journey. Don't make a strange face. Be happy. Be positive. This pain is temporary. But if you quit, no, it'll hurt forever. Pain is temporary and quitting lasts forever. Thank you so much, everyone, for this beautiful participation. Thank you so much. And before leaving, क्या है? Yes, we will cover the systemic pediatrics also. Yes, एक गाना okay. Okay, एक गाना जल्दी सुनाते हैं. दिल की डाली पे कलियां सी खिलने लगी, जब निगाहें निगाहों से मिलने लगी, एक दिन जिंदगी इतनी होगी हंसी, झूमेगा आसमां गाएगी ये जमी, मैंने सोचा न था. That's it. My throat is little gone, so the sur will not be very high. It will be a soft pitch. Thank you so much, everyone. I had a comfortable time with you all talking. I hope you had a comfortable time. It was all about sharing knowledge, dude. Nothing else. Okay, if you understood the concept, very good. Watch the video again, make the notes, and just enrich yourself with good knowledge. Nothing else I want. And we all should uplift the mankind, become good doctors, good human beings, enjoy every moment of life. And don't be a frustrated soul. Be a sparkling, happy, solid 16.5-inch biceps soul. Please take care. Love you all. Bye. Bye. And please remember, a baby in the milestones can say bye, bye, bye 9 months.